Well, Oklahoma nursing students are facing a shortage of teachers. As Chaz Kaiser reports, fewer teachers now could mean fewer nurses in the future.
I don't feel any breathing.
Charlotte Pruitt's desire to help and comfort people led her to nursing, and her desire to educate others about the field led her to teach.
I saw lots of students when I worked at the hospital. I was always the magnet to take the students around and show them skills and work with them while I was actually working too, and I enjoyed it, and I wanted to continue doing that.
She hopes more Oklahoma nurses will choose to also become teachers because of the impact they'll have on their students' lives and the fact that they're desperately needed.
There is a pretty good applicant number of students wanting to get into the profession. There's a much lower number of teachers and nurses willing to teach it. And we shop.
This disparity led only 40% of qualified applicants to be admitted to Oklahoma's 2-year nursing programs and only 68% to 4-year nursing programs, creating a roadblock for students and further worrying those in the healthcare industry.
If we don't get more students out into the workforce, we are going to be stressed ourselves with the overwhelming number of patients to take care of and fewer nurses that are going to be there to take care of them.
The problem is almost like a ticking bomb to the executive director of the Oklahoma healthcare workforce. According to Cheryl McLean, by the year 2012, we will have 3,000 fewer nurses than we need, and the increasing lack of nurses couldn't be coming at a worse time.
We have an aging population in Oklahoma. We also have an aging workforce in Oklahoma. So many of the baby boomers are set to retire by 2012. The rest of the boomers actually, and that's going to be significant for our state.
Our goal is to keep you pain-free and ambulating as soon as possible.
Partially because hospitals may have to scramble to meet the needs of older citizens.
People that are over 65 years old consume 4 times as much health care as those under 65.
And of course, to make sure you are suctioning the correct person.
And as Charlotte knows, a hospital with too few nurses can't offer the care patients need.
Safety can be a major issue, and that's the #1 issue in hospitals. It's going to be more difficult for patients if they have pain and they, call for a nurse and she's, 3 or 4 rooms down tending to another patient and there's nobody else there to tend to them. They would be waiting longer to get their treatments.
While the solution to the problem may seem as simple as just asking more nurses to teach, there are a number of factors that prevent many from doing so, and not surprisingly, money is one of them.
Nurses can get more income working in a service setting, in a provider setting, than they can teaching.
Nursing instructors with a master's degree can expect to make between $45,000 to $52,000, while nurse practitioners with a master's can earn between $60,000 to $80,000. And that's not even including a signing bonus.
It's difficult for people to really want to take a $20,000 pay cut to do that.
Charlotte teaches nursing for a career tech program, which she says pays instructors a bit higher than average. But she still had to pursue a master's to get the position, and she considers this another potential roadblock for nurses.
If you're taking a pay cut and then you're having to go back to school, a lot of people just can't afford to do that.
A nursing master's degree program can cost more than $17,000. But Charlotte says she is happy with her decision to teach.
Teaching is fun. It's so rewarding to see somebody that has a knowledge base of almost 0 and you start building them up and you see by the end of their program how much they've learned, and it's like you've given them wings to take off.
And joining me now is our Chaz Kaiser. Well, Chaz, it looks like the nursing shortage will be a huge problem for Oklahoma for quite some time. Now, is this same problem, is it typical around the nation?
Oh yes, practically every state is actually affected. While this story focuses on Oklahoma, this is actually a national problem, and it's one that's been building up for years. According to the U.S. government, more than 1 million new and replacement nurses will be needed by 2016.
Wow, that's a heck of a lot of nurses. Is there any indication that we will have enough nurses by that time?
Oh, well, I do not like to paint a very dismal picture, but when you look at the data, it really does not seem possible. To meet the projected demand for nurses, the U.S. will need to graduate 90% more nurses for nursing programs than they currently are doing right now.
And that brings us back to our original problem of not having enough nursing instructors.
Exactly. Now, to be fair, there are a number of things that states, including Oklahoma, are looking into or currently doing to increase nursing faculty. And this includes helping nurses pay for some or all their education so they can actually afford their advanced degree to teach because it is expensive, and increasing the salaries of nursing faculty so they actually want to teach.